Maverick, irresponsible. Cowboy is another one. Nowhere near a cowboy.
Look at me now. Look at me now. Look at me now.
It's hard to appreciate what a rare visionary Dr. Balky is. You don't have to have been in healthcare. When you're in his operating room, you can see that it's not about the robot, it's not about advanced technology, but it's someone who has spent a lifetime thinking about the intersection of advanced technology to steward human health in a fundamentally different way.
So I was trained to do heart surgery the way it's always been done, through a big sternotomy, stopping the heart. You would see patients who had a very successful operation, but had a terrible, terrible outcome in terms of their ability to get back to a perfect lifestyle because of the fact that they had their sternum opened. It was just psychologically difficult for them to look at it every day in the mirror and feel that they had been violated to some extent. And that made me think really hard as to, can't we do this another way? There was no question in my mind that the least invasive approach was the approach that I was going to take. And then, all of a sudden, there's this robot. To me, that was the missing link. When we first started, there was a lot of pushback because cardiac surgery has been resistant to that for many, many years. The whole setup of stopping somebody's heart and being in a console separate from the table was foreign.
So the robotic operating room is just a fundamentally different human landscape. When you introduce a robot into a human team, it changes the way that team interacts. And Dr. Balky has spent decades thinking about all these small variables and how to still find asymmetric advantage at the intersection of a robot and a human team. But one of the biggest challenges is precision of communication. How do you get people in an operating room who are decentralized to all be on the same page with the same mental model? And so 15 years ago, he stumbles upon this very interesting solution: Bluetooth headsets.
And when I started doing robotics, I was in Milwaukee, so Harley-Davidson was right down the street. If you're riding a Harley with somebody, you want to talk to them, and it's so loud you can't, so you got to put a headset on. And I would say to my assistant, we need to get those things. The minute we started using them, we never looked back. I mean, it really changed the ambiance of the room, and it made it such that we were talking with regular tones, weren't shouting over each other, and the case was just so much more fluent.
One of Dr. Balky's superpowers is he understands beyond technical communication that every procedure is about the energy of the human system. There's this extraordinary moment in every one of his procedures where he says, "Can I get the lights down?" And as the lights come down, you feel that human system focus, the energy of the room focus, voices lower, and then that team moves from the frenetic pacing of the traditional operating room into this almost fluid dance with technology.
The choreography of the operation is the most fascinating thing. The symphonic cadence to it. I like that word, orchestra. Everything is flowing gracefully. No wasted movements. Everybody has their specialty, and you respect their specialties.
When we think about teams of tomorrow, whether it's in medicine, in sport, the creative arts, there's this inherent challenge when someone can see beyond the horizon. They can see how a technology is going to bring change or a better path. But doing that requires this really careful balance. Understanding how to steward risk and the unknown, while at the same time instilling confidence and focus in the human system. One of the things that is so rare about Dr. Balky and his team is they are pursuing a higher standard, while at the end of the day, keeping the most essential focus at the center of their mission.
The environment that we want to create is an environment of people proud of what they're doing and how they're contributing. I feel like when you have a team member, they are trying their hardest. I don't like to dress somebody down, which is kind of like had been the tradition. Big surgeons make big incisions, big surgeons are very critical, and you know, all the rest of it. And this is how we train. I don't think that's helping them. It's not helping me. It's definitely not helping the patient. There's a fine line between going too far and going just far enough and developing innovation. And so the description of maverick or cowboy to somebody who is doing something outside of the tradition is good if they're not taking care of all these things that can go wrong. But for those of us who've actually succeeded in doing this, I don't think you can call us mavericks.
Now. Look at me now. Look at me now. Look at me now. I wonder if I made you proud.